A 34-year-old man presents to the emergency department with a 3-day history of fever, headache, myalgia, and a dry cough. He recently returned from a camping trip in Arizona, where he spent time hiking in a desert area. On examination, his temperature is 38.9 degrees Celsius 102 degrees Fahrenheit, blood pressure is 120/80 mmHg, and heart rate is 90 per minute. Lung auscultation reveals scattered crackles. A chest X-ray shows patchy infiltrates in the right lower lobe. Laboratory tests are notable for an elevated white blood cell count with eosinophilia. He is given supportive care and discharged. 2 weeks later, he returns with persistent fatigue and joint pains, but his respiratory symptoms have improved. Which of the following is the most likely diagnosis? A. Histoplasmosis. B. Tuberculosis. C. Coccidioidomycosis. D. Legionnaire's disease. E. Mycoplasma pneumoniae infection. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. The correct answer is C. Coccidioidomycosis. Coccidioidomycosis, also known as valley fever, is caused by the dimorphic fungus Coccidioides species, which is endemic to the southwestern United States, particularly in desert regions like Arizona. The infection typically begins with flu-like symptoms such as fever, cough, and myalgias. Patients often present after activities like hiking in dry, dusty areas. Chest X-ray findings can show infiltrates, and eosinophilia may be noted in blood tests. While the initial illness is self-limited, some patients may develop more chronic symptoms like fatigue and joint pain, as seen in this patient. Why not the other options? A. Histoplasmosis. This is more common in the central and eastern U.S., particularly the Ohio and Mississippi River valleys, and is associated with exposure to bird or bat droppings. It's unlikely given this patient's exposure history in Arizona. B. Tuberculosis. Tuberculosis typically presents with chronic cough, weight loss, and night sweats, rather than the more acute presentation seen here. Additionally, there's no specific risk factor for TB in this patient. D. Legionnaire's disease. This is caused by Legionella and can present with fever, cough, and gastrointestinal symptoms. However, it is more commonly associated with exposure to contaminated water sources, like air conditioning systems, not desert environments. E. Mycoplasma pneumoniae infection. This can cause walking pneumonia with cough and fatigue, but it's not typically associated with desert environments or eosinophilia. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.